Hi, my name is R Marquez, and today I'll share with you my health promotion intervention. It's titled Increasing the Proportion of Hispanic Children Who Show Resilience to Challenges and Stress, a Mental Health Intervention, at the clinical site of Fallbrook STEM Academy. The target population that I identified could benefit from a health promotion intervention is the Hispanic children of Fallbrook STEM Academy who are developing English proficiency. An important consideration of this target population is to note their values, beliefs, and barriers. Communication with these students and their families should be clear, concise, and with the use of interpretation services if needed. Providing individualized assessments and avoiding generalizations is necessary to focus on the ways to support their mental health. In alignment with the Healthy People 2030 objective of increasing the proportion of children and adolescents who show resilience to challenges and stress, I identified that enhancing the existing social emotional learning program to be more culturally tailored could support this objective and its goal of protecting and promoting the public health issue of mental health. This specific target population faces individualized challenges and stressors that affect the Hispanic population. With 86.5% of the student body at this school being Hispanic and 45.7% English learners, there are language barrier challenges that they encounter in their day-to-day lives. Fallbrook STEM Academy is not a dual language school. This contributes to the challenges and demands of managing stress while navigating a new culture. Having to face these circumstances at such an early age can increase thoughts and emotions that can lead to mental health issues such as anxiety, depression, and feelings of inadequacy. This high priority public mental health issue carries great significance because it's aimed at supporting the emotional needs and tailored to the specific areas where it affects the Hispanic children of Fallbrook, California. It can encourage healthy and effective ways of managing situations and strengthening their mental health. Ensuring they understand and have the tools to navigate emotional challenges and are able to express their needs is essential for resilience and academic success. My focus is not only to increase resilience and coping strategies, but also to encourage them to ask for help. Through extensive online and in-person clinical research, I was able to learn more about the rural city of Fallbrook, California, and the population that makes up this community. I explored the surrounding area of Fallbrook STEM Academy to learn more about the area and the resources. In addition to exploring the area, I used reliable online data to obtain facts and statistics about Fallbrook, California. Some examples of these were the Fallbrook Unified School District, data census, city data, and Healthy People 2030 websites. So a little more information about Fallbrook STEM Academy and its students. During my time there, I was able to witness how having a language barrier affects a lot of the children at that school. In the 2023 to 2024 school year, chronic absenteeism counts for Hispanics at Fallbrook STEM Academy were at 129 versus only 14 for white students. A lot of their students fall under the socioeconomically disadvantaged category. It's 91.4% of them. That's almost everybody. Their English learner program progress is in the red zone. It's in the decline. So there's a lot of areas that are concerning for the students that are attending here, and not just them, but throughout the nation. We all know that systemic barriers can limit families from seeking help, and current pediatric mental health crisis impacts Latinos in the U.S. as seen by increased levels of depression, anxiety, and substance abuse. There are a variety of stakeholders for this objective and this intervention that are made up by mental health professionals, policymakers, teachers, nurses, counselors, community organizations, families, parents, and the children themselves. These stakeholders work as a support ecosystem where Fallbrook children can feel safe and use the tools that they learn through the enhanced culturally tailored social emotional learning program to show resilience to challenges and stress in their life. So for my design, I came up with two interventions. The first is to enhance the existing social emotional learning program to better support the Hispanic students who are developing English proficiency. The goal is to have a strengthen and enhance the emotional well-being and coping capacity of the Hispanic students at Fallbrook STEM Academy who are developing the English language by integrating culturally responsive strategies, and this could be completed within 6 months. Phase one would be where a timeline is introduced to staff by flyers, emails, and it would have dates, online modules, resources, and a list of activities that they could look forward to so they know what the plan is. In phase two, we would have in-person training to incorporate the case studies. There would be role playing. Bilingual emotional vocabulary would be added to daily instruction, and creating coping skills with visuals such as posters that are both in English and language in the classrooms and throughout the schools would also be a component. In phase three, staff would know how to de-escalate and provide relief options to address stressors and encourage resilience. I would incorporate bilingual coaching sessions that would be available every 3 months to just reinforce those skills and that training. So for the second intervention, this is where we engage, empower, and educate Hispanic families to support their children. The goal here is to increase confidence, knowledge, and engagement so they can support the emotional well-being of their children at Fallbrook STEM Academy. This also has 3 phases. In phase one, it's all about building relationships and connecting to families and highlighting the need for this intervention. In phase two, we provide culturally relevant and bilingual social emotional learning workshops and classes to educate the families about the strategies and how to support their children. We would offer information that is bilingual, website links, online resources, and local resources that can be shared and distributed to the families that attend. And these sessions could be recorded so they could be shared to those families and family members who cannot attend the workshops. So everybody's informed. In phase three, we reinforce what we've already established and we grow, we make it grow. We can do that in a variety of ways, and one way is by receiving feedback from those participants that have attended and finding what areas could improve. Feedback from families can provide valuable information. Tracking referrals and conducting pre and post surveys can also help in recording the status of interventions and their outcomes. Another area that can be assessed is to see if there is a downward trend in the number of absences by Hispanic students since the implementation of these interventions. One outcome that I was able to see is that the families invite connections and are open to learning more ways to help their children's mental health. Mental health affects life choices. Primary education measures include training of culturally responsive social emotional learning and building awareness. For secondary measures, early intervention teaches signs and symptoms of emotional distress and coping techniques. Tertiary measures include the coordination with the school team and the mental health services that can reduce the long-term impact of mental health. Call to action and follow-up strategies. Data-driven monitoring, student and staff feedback, ongoing engagement, self-reflection, and community partnerships can offer great information on these interventions and how they're working on the students. In addition to those, ongoing workshops, ongoing coaching, exploring family dynamics, celebrating achievements, and continued advocacy work can all be part of the solution. Media information can be shared online, via text, and through the school service, and can all be beneficial to the students.